The azole antifungals are a family of medications used to treat mycoses, or fungal infections. Mycoses can be superficial, like on the skin or hair, or develop into systemic infections in immunodeficient people. Antifungals work either through fungistatic action, meaning that they inhibit fungal growth, or through fungicidal action, meaning they kill the fungi. Azoles are divided into two major families of antifungals: imidazoles and triazoles. Most fungal cells have a tough outer cell wall and an inner cell membrane. The cell membrane is mostly made of phospholipids, with some sterol or modified steroid molecules mixed in. Humans have cholesterol, while fungi have ergosterol. But both sterol molecules help keep the cell membrane stable at a wide range of temperatures. Now, the precursor to both molecules is linosterol. Fungi have a cytochrome P450 enzyme called 14 alpha demethylase in their mitochondria and endoplasmic reticulums, which converts linosterol into ergosterol. Without ergosterol, the structure of the cell membrane will be disrupted. This will cause membrane-bound proteins like ion channels to stop working properly. The membrane also becomes fragile, which eventually leads to inhibition of fungal growth. The azole antifungals include imidazoles like clotrimazole, isoconazole, miconazole, butaconazole, fenticonazole, and ketoconazole, as well as triazoles like fluconazole, itraconazole, and voriconazole. The only difference between the two groups is that imidazoles contain an imidazole ring, while triazoles contain triazole rings. These medications work by inhibiting the 14 alpha demethylase enzyme. However, they also inhibit human cytochrome P450 enzymes to a lesser degree. Because of this, the vast majority of azoles come in topical form, and they're commonly used to treat superficial mycoses. Azole creams are used for treating dermatophytosis, or ringworm, which is a red, itchy, scaly, circular rash on the feet, groin, or armpit area, caused by the trichophyton fungus. These fungi are also responsible for the more common athlete's foot or jock itch. Additionally, azoles can be used to treat tinea versicolor, caused by Malassezia globosa. This disease is characterized by hypopigmentation or hyperpigmentation in patches of skin. Last but not least, topical azoles are also used to treat yeast infections, such as oral or vaginal candidiasis, caused by the Candida species. Topical use of azole antifungals is generally considered to be safe, since absorption through the skin is minimal, and the most common side effect is skin irritation. Now, certain azoles can be taken perorally or through IV for the treatment of systemic mycosis, and orally or vaginally for candidiasis. But due to their effect on cytochrome P450, they're usually the second or third line therapy after other medications, like amphotericin B. The azole with the narrowest spectrum of activity is ketoconazole, which is only used for candidiasis. Next, fluconazole is effective against Candida species as well as Cryptococcus neoformans, so it's often given as a prophylaxis medication for the prevention of cryptococcal meningitis in people with AIDS. Wider spectrum azoles like itraconazole and voriconazole can also treat the previous fungi, but in addition, they are effective against histoplasma and coccidioides species. Itraconazole is the first-line treatment against blastomyces, while voriconazole is more effective against aspergillus. The broadest spectrum azoles, like isovuconazole, can be used to prevent a variety of fungal infections in the immunocompromised, or for the treatment of serious aspergillosis infections. They are the only azoles that are effective against mucor and rhizopus species, which can cause mucormycosis, a serious infection of the sinuses that could spread to the surrounding bones, blood, and brain. If used to treat systemic infections, the azoles are hepatotoxic, meaning they damage the liver. They also inhibit cytochrome P450, which leads to the buildup of medications like warfarin and phenytoin, which are metabolized by these enzymes. These medications, particularly ketoconazole, also inhibit the synthesis of androgens in the adrenal gland and testes, leading to gynecomastia and infertility. Finally, voriconazole can cause visual disturbances in rare cases. Now, how about we make a simple and fun mnemonic that'll help you efficiently memorize and retain all these farm facts. For the indications of topical azole creams, let's have a soccer player that just got out of the shower. On his body are red rings for ringworms. His feet are on fire, representing athlete's foot. But more worrying is that his jockstrap is also on fire, representing jock itch. Maybe they should clean that shower. His soccer ball has patches of light and dark colors, so it represents tinea versicolor, which causes hyper and hypopigmentation. There are tiny candy mushrooms growing on top of the ball to represent candida. Now, for the systemic azoles, let's have a street that's narrow on one end and wide at the other for the different spectrum of the azoles. On the narrow end is a gate, and the gatekeeper has a giant key for ketoconazole. The gatekeeper is sitting on a giant candy mushroom since candidiasis is the only indication for this drug. Out of all of the azoles, ketoconazole has the most anti-androgenic side effects, like gynecomastia, so let's put a large bra on the gatekeeper. Behind the gate is a man playing a magic flute for fluconazole. The problem is that his flute playing has raised an undead rooster, or cock, from the nearby crypt for cryptococcus. The rooster is hungrily pecking at a brain, since it causes cryptococcal meningitis. Next, we have the wider spectrum of azoles in the middle part of the street. Here we have a duel between an Italian plumber for itraconazole and a grizzled warrior for voriconazole. The warrior has an eye patch to help you remember voriconazole causes visual disturbances. The two are fighting over a rare cockatoo for coccidioides. The bird is sitting on a history book for histoplasma, and I bet if you asked, it could quote some random historical facts. Both medications are effective against these two species. The warrior is using a large asparagus, since it's the preferred drug for aspergillus, while the Italian is holding a stick of dynamite, since it's the more effective drug for blastomyces. Finally, the widest part of the street is connected to an island for isavuconazole. Living here is a kid with cancer undergoing chemotherapy. His only companion is, unfortunately, a rhino covered in mucus, for Rhizopus and Mucor species. The only vegetation here is giant asparagus, for serious aspergillosis. For side effects of systemic azoles, let's put a large liver-shaped rock for hepatotoxicity. It's crushing a chrome-colored cell, since it's a cytochrome P450 inhibitor. Alright, as a quick recap. The azole antifungals can be split into imidazoles or triazoles based on their molecular structure. They inhibit a cytochrome P450 enzyme called 14-alpha demethylase, which is in charge of making ergosterol for the cell membrane. Most azoles are used topically for superficial mycosis and can cause some mild skin irritation. Some can be used for systemic mycosis, but they cause hepatotoxicity and inhibit cytochrome P450. Ketoconazole in particular has a strong anti-androgenic effect. But wait, there's more. Here's a mind map with all of the mnemonics from the video. Go ahead and pause so you can test yourself and see what you remember. But stay tuned for the answers after the credits.